Good afternoon, everyone. Thank you for being here with us today. We are pleased to welcome you to join our session. Before we get started, let me introduce myself. I'm Li Chu. I'm the host for today's session. I'm also an audiologist from 20dB Hearing, Johor Bahru. Now, you may have a question. What is an audiologist? As an audiologist, my roles are to evaluate, diagnose, and manage children and adults with hearing-related disorders. In today's session, we will discuss common causes and intervention for children with hearing loss. Do not be surprised, about 2 to 3 out of every 1,000 children are born with a detectable level of hearing loss in one or both ears. More than 90% of deaf children are born to hearing parents. Many parents are unaware of warning signs and of hearing loss in their children, and the impact of hearing loss are broad and can be profound. They include a loss of the ability to communicate with others, delayed language development in children, which can lead to social isolation and frustration. So without further ado, let's welcome our guest today, Dr. Jennifer Lee Pickway. Dr. Jennifer Lee is a consultant ear, nose, and throat and head and neck surgeon who has a vast experience in her field since she joined the ENT faculty in 2002. She obtained her MBBS degree in 2000 and further her master's in ENT in University Malaya, where she was gazetted as an ENT specialist in 2009. She has worked in various tertiary hospitals in Malaysia like Ipoh, Klang, and Selayang. She has trained, guided, and inspired many budding ENT doctors and also involved in the Malaysian ENT Master's Program final examination as an examiner. Dr. Jennifer Lee joined Regency Specialist Hospital in early 2021 and has treated patients of all ages from children to the elderly. The scope of different diseases that she treats range from ENT infections, tumors, and cancers. Good afternoon, Dr. Jennifer. Would you like to say hi to our audience?
Yes, hi, good evening, and thank you for having me.
Yeah, we are grateful to have Dr. Jennifer with us today. Dr. Jennifer, would you like to share with us about the different types of hearing loss in children?
All right. So in children, they are mainly classified as congenital or acquired, where congenital is basically, it means that the child is having a hearing loss since they were born. So it may be only evident after the child has entered the few months into life or even into the first or second, third year of life. And the other cause of hearing loss in children is acquired, meaning it could be an infection that they have acquired during their childhood, or even trauma that has caused damage to the external, middle, or even the inner ears. Okay, so I will just put an intro. We go to the first slide first, the introduction.
Yeah, sure.
All right. Okay. So just an introduction first into the anatomy of the ear. As we all know, the ears are divided to many different parts, but basically into three major parts, which are the external ear, the middle ear, and the inner ear. So if we see the hearing loss, like I said before, it can be congenital or acquired, and it can also be further divided into conductive hearing loss or sensorineural hearing loss. And conductive, as its name implies, it basically means that they can be a physical obstruction to the transmission of sound to the hearing nerve. And that could be due to infections and even any foreign bodies in the ear and even trauma. And the other cause for hearing loss, it could be a sensorineural hearing loss, which is basically damage to the hearing organ, which we call as the cochlea, and the hearing nerve itself. And this also can be due to infections and can be a congenital cause also. So next slide, I will show you an example of a congenital, and even it can be an acquired cause for hearing loss of the external ear. So this is a conductive hearing loss. As we see, these four pictures show a deformity of the external ear, of which this part of the ear is called a pinna. So if we see on the grade 1, the pinna is almost normal, a little bit misshapen, a little bit deformed, but you can still see most of the ear. And you can even see the hole that leads into the eardrum, which is the ear canal. And as we progress, grade 2, grade 3, grade 4, the severity and of the deformity of the ear deteriorates, it worsens, till the grade 4, you do not even see a hole in the ear at all. So this will prevent any sound conduction from externally into the eardrum. So next slide. So the next slide will just show a very schematic diagram of the ear, the external auditory ear canal, which is that long tunnel in the ear where we usually put in our cotton buds, and that ear canal will end with an eardrum. Like the picture in the top, you will see a blue color structure. That is the eardrum. So in canal atresia, the entire canal is actually narrow to a point where it can be absolutely obsolete, where there is no continuation to the eardrum at all. So the incidence of this happening is about 1 to 7,000 to 20,000 live births. And like I said, it can be acquired by trauma and infections. And this is usually treated with reconstructive surgery and even hearing aids. And very importantly, to start the child with speech therapy as soon as possible. So next slide, we will show you a very common cause of hearing loss too in children, which is basically earwax. And we all know earwax can be a problem that can cause us to have ear pain, a blocked sensation in the ear, and as usual, hearing loss. So the picture before we show you the entire canal filled up with earwax, and the picture on the right showing a clean ear canal, and you can even see the eardrum now. So the next slide will show you otitis media, which is basically infection or inflammation of the middle ear, and there will almost always be some degree of fluid within the middle ear, and the fluid may be sterile or even in a pus form. It may cause severe ear pain with fever and even reduced hearing. And some patients may even have pus discharging from the ear. So next slide. So if you can see the diagram on the left-hand side, we can see this bluish purplish shaded area. This is the area where it is called the middle ear. So otitis media is infection or inflammation of this middle ear. So the diagram on the right-hand side, we can see two pictures of the eardrum. The one in the left, which is the middle diagram, will show you a normal eardrum. And on the right-hand side, you can actually see there's a yellowish hue and color to the eardrum, and it's actually more bulging. So there is some fluid collection behind the eardrum, and that is most likely pus. The next slide will show you a very common problem in children, which is called as otitis media effusion, or short form as OME. You will see this very commonly in children, especially after a bout of flu, what we call is URT, upper respiratory tract infection. And this patient will have reduced hearing, usually on one side, but it can be on both sides. It may or may not be accompanied with pain, but definitely with some reduced hearing. and it is akin to having like water stuck in our ear after we bathe, or even akin to like an ear block sensation when we are flying in an aeroplane. So when we put in a camera and have a look into the ear, we can see bubbles actually. So these bubbles are actually some fluid collection behind the eardrum, and it is not in the ear canal. So now we go to the next slide. So types of otitis media, it can be divided, of course, into acute and chronic. So acute means the symptoms that the child is feeling, it should be about 3 months or less. And if it's more than 3 months, then we call it a chronic disease. So next slide, we'll see the causes of otitis media. Like I said before, it is almost always caused by infections from the nose and throat. And even it can be caused by swellings or tumor within the nose, and bacterial and viral infections. But most commonly is the number one, infections from the nose and throat. Next slide. So how do we treat otitis media? Because it's an infection, we have to treat it with antibiotics, either topical antibiotics or systemic oral antibiotics, or even intravenous antibiotics in the hospital. Then, of course, we need to treat the nose and the throat. And if conservative management fails, then we can go for the surgical option where we perform a myringotomy, which is basically making a small opening into the eardrum, and we put in a small plastic tube into the eardrum to allow ventilation. So you can go to the next slide where I'll show you. The picture on the left is the otitis media effusion. You can see bubbles. And on the right side, the surgery has been done for the patient where a small plastic tube is inserted, and it will stick to the eardrum, and it will form a continuation from external ear to within the middle ear. And this will allow all the fluid inside the middle ear to evaporate. So next slide, we will talk about the sensorineural hearing loss. So if we see from this diagram, the yellow part of the ear is the external ear, is all normal. So when we enter the middle ear, the purple part, that is also all normal. So the only reason the child could be having a problem with hearing, it could be the inner ear, which is the orange colored structures. So that is the cochlea, which looks like the shape of the snail, and deeper in is the hearing nerve. So the next slide. So there are many causes of sensorineural hearing loss. It can be syndromes, meaning the child can be born with a genetic disorder. It could be part of a syndrome. Even the mother, while she is pregnant with the child, she could have had infections like rubella, cytomegalovirus, HSV. All these can be transmitted to the unborn child. And even the child after this born can have septicemia, which is basically infection, a very severe infection of the whole body, and mumps can cause hearing loss also. All right, so the next slide, we will go to what are the signs and symptoms of hearing loss in babies. So this is a very nice diagram because it can alert the parent on what she or he should expect from the child. And if he doesn't or she doesn't see these signs from the child, then she can be alerted and she can bring the child to a doctor, and the ENT doctor can evaluate and perform necessary tests. So if we just go through the first one, from birth to 4 months, The newborn doesn't startle at loud sounds. And as the weeks go by, doesn't respond to the voice. So when the parents are talking to the baby or singing to the baby and calling the baby or making loud sounds and the baby doesn't seem to respond to those sounds, that is an alert. So we'll just go on to the next slide. So what to do when you suspect a child is having reduced hearing? So a parent may or may not be wrong or right, but you have the suspicion that my child is having some degree of hearing, may not be fully deaf, but every time I call my child, I have to call a little bit louder than normal a few times, or I have to go right in front of my child to call him or her before they actually recognize my voice and acknowledge my calling to them. So when that happens, you can see an ENT specialist. So the ENT specialist will perform very simple ENT examinations. We will see, first of all, the external ear, and we will check the middle ear, and we will check the nose and throat also for any other cause like infection or tumors. And after that, we'll perform a hearing test and a tympanometry test. Next slide. So all these hearing tests can be started even on the first day of life for babies. So in Malaysia, the universal hearing screening in Malaysia is already implemented, and it is done especially for all babies that are admitted to the neonatal ICU in whole of Malaysia. So the test that is performed is, as the picture has shown, is called an OAE, autoacoustic emission test. And the results are very, very simple: refer or pass. Refer means there is some abnormalities and it will be referred to the ENT and the audiologist. And if they pass, then it pass, meaning it's all normal. So the next slide will just show you the simple examination. The picture on the top is just a simple otoscopic examination of the ear. It can be done bedside in the clinic. It is painless, and this will allow the doctor to visualize the external ear, the ear canal, up to the middle ear. And the picture on the left bottom is a very simple test, also very painless. It's called as a tympanometry test, and it can be done in the clinic setting. And on the right is a pure tone audiometry test, which is done in a soundproof booth, and it can be done even for children. So the next slide. So I'm sure some parents will be thinking, how to prevent hearing loss in children? Well, we can do very simple things like avoid inserting any instruments into the ear. Most common things that we like to insert are cotton buds, even metal or plastic ear diggers that we buy from pasar malams. Yes, we should avoid doing that altogether. Another thing very important that we should do is, if your child starts exhibiting any nose allergies, nose infection, throat infection, sore throat, cough, it should be treated immediately so that this infection does not escalate and affect the ears. So we go to the third point, where treatment is done early is very, very important. And another thing we can do is to know our drugs, to avoid any drug that can cause toxicity to the hearing nerve, or what we call as ototoxic drugs. And examples, very common examples of these drugs are like Brufen, which is a painkiller very commonly given to children and adults, and certain antibiotics like streptomycin, aminoglycoside, antibiotics, and all these lists of medication or drugs which are ototoxic are readily available to, we can Google it, and it's already available in the internet for us to identify. So the next slide will show you a whole list of medications, and again, we can find it easily in the internet. And that's the end of my slide. Thank you.
Thank you so much, Dr. Jennifer, for your wonderful sharing. We learned a lot about like different types of hearing loss and some of the common causes. I think we might not know viral infection, or maybe sometimes given the antibiotics, might cause hearing loss in children, something that we are not really aware of. And there are also some signs and symptoms, because there are always parents who notice their child to have a speech delay, but they are not aware of the sign symptom, like not really responding to some moderate sound or soft sound. So they thought like, oh, their child is very healthy, they can grow up like other children, except talk a little bit late. So there may be some sign and symptom that the parents miss. And also some of the treatments done by the ENT. So I have some additional information that, because Dr. Jennifer mentioned about hearing amplification devices just now, like the hearing aids for children with hearing loss. So I would like to also share some of the management done by the audiologists, such as the use of hearing aids, implant, and assistive listening devices with our audience today. So basically, there are a few type of hearing loss, hearing aids available for the children, and it depends on what are the type of hearing loss that the ENT they have diagnosed, they already assessed. So I will briefly share a few types. And the first type is the common type of air conduction hearing aids, meaning like you can see those elderly or those adult or children, they wear hearing aids with a ear mole here, with an ear mole here, and a hearing aid behind the ear. So this one is the most common type of hearing aids. It looks like this because we know sounds transmitted through the air, it has a vibration. So when there is some sounds, stimulus, when we are talk to the child, so there will be a microphone to pick up all the sound. And once the microphone has picked up the sound, it will send the signal into the machine. This is the hearing aids, and the hearing aids will amplify the sound and send it to the ear hole and send it to the ear mole, so that you can from the ear mole itself, the sound will be sent into the ear canal and then into your eardrum, and it causes vibration so your child can hear better. There are also some of the features here, like the volume control, like it also work as the program button or on-off button, and there will be different types of hearing aids with battery and also rechargeable model. So it actually catch all the sound and amplify it and send it to the ear canal, so it helps your child to hear better. This is the type of hearing aid that is suitable for children, especially very young children like babies and children not at the age of teenagers yet. They really need effort to take care of the hearing aid, so you cannot give them very small hearing aids, very difficult to handle. This will be the hearing aid that is suitable for young children. And let's say if your child has grown up into a teenager, there will be pediatric patients who need different type of hearing aids, like they can handle the hearing aid better. There will be some cosmetic concern. They want to look pretty. They don't want the hearing to be so bulky. So they may change the hearing aid to become this type, or they can be fitted with this type of hearing aid. It is also the air conduction hearing aid, where it captures all the sound and sends it into the hearing aid. It still has the microphone, the programming button here, but what difference would be, instead of using the ear hook and also the ear mole, which is very large for a teenager, so they can use this kind of receiver hearing aid where there's only a slim tip, like a slim tube here with the receiver inside, and the dome will help to retain the hearing aid in the ear, which cause the child to have a smaller hearing aid, and it is also more comfortable for a teenager. While we talk about like the basic air conduction hearing aid, there will also be some hearing aids that we have discussed just now, with children with atresia, children with malformation of the ear canal, and also the pinna. They may not be able to have the hearing aids that to be worn directly on the ear pinna. So what we can do is we can prescribe them with the bone conduction devices. So how does this aid works? When the sound transmitted through the air and there's vibration, it actually vibrates what is placed behind on the mastoid here, what is placed here. So it causes the device to vibrate and send the vibration to the skull. So it actually sends the sound directly to the cochlea, the hearing organ, and bypass all the outer ear and also middle ear region. And of course, for some children, you may consider to have this implant device. You have to consult your ENT whether it is suitable or not, the child to do this BAHA, we call it bone anchored hearing aid. This is the implant device. This is a non-implant type of bone conduction hearing aids. And of course, besides all these type of hearing amplification devices, we also have cochlear implant. Let's say if your child is diagnosed with severe profound hearing loss, hearing aids may not provide enough amplification for your child. There's the limitation of the hearing aid. You may consider to use a cochlear implant because that actually bypass the damaged part of the ears and it stimulates your auditory nerve directly. This is how a cochlear implant looks like. It's very similar to the air conduction hearing aid, like the behind the ear model, but there is a coil here to connect it to the headpiece. So how does it work? There is actually the internal parts here where the surgeon will implant it to your child, and there will be the external processor in the picture just now where we show it actually has a magnet at the headpiece. So the magnet will stick together to the implant. You use the magnet to fix the positions, and the sound will be transmitted into this microphone. The microphone will collect the sound, process it, and send it to the headpiece. So from the headpiece up there, it will send it to the electrodes. You can see there is a picture, the first left upper picture here. There is a little tail here. That is the electrode. So we bypass all the damaged region, like the cochlea has damage. We straight away stimulates the auditory nerve. So that can help children with severe profound hearing loss. So in a simple way, like we talk about hearing aid and cochlear implants. So just as a simple reference for the parents, when should you consider for an implant if your child has not received enough benefit from a hearing aid and the hearing loss level is so severe. So you can have a look at this audiogram. Basically, at the red region here, well, probably I explained a little bit about the audiogram first. You can see there is like a frequency at the bottom of the audiogram. You have a low frequency, lower pitch, and 8,000 kilohertz, 8,000 hertz. That will be a high frequency, and there will be also different intensity. When you have done the hearing test just now, like the play audiometry or pure tone audiometry or auditory ABR test, the sleeping hearing test or any other hearing test that can give you a result to show that at which part your child is hearing, what frequency and what intensity your child is hearing. You may kind of refer to this audiogram also. If your child has a very mild loss or just a moderate loss, hearing it can provide enough amplification, and you proceed with the speech therapy. You monitor the child's hearing consistently, while you do not need to consider for an implant because hearing aid can provide you enough benefit. If it is not enough, like you can consider for the assistive listening devices that we will discuss briefly later. But let's say if your child has a severe profound loss, probably like 70 decibel, until more than 90, more than 100, you may consider for an implant assessment because we know hearing aids may have some limitation when it comes to providing gain to the children. definitely implants will be something that you want to consider. And we look at the green region here. Let's say if your child has a sloping loss, meaning like there is some a few frequency with very good hearing, but the rest at a high frequency at the profound region, definitely you have to consider for implant, because we know that high frequency, in order to have good access to sound, that's gonna help your child to develop speech. If there is no good access to sound, it's difficult for the child to hear and to talk, because muddy in, muddy out. What you hear is what the child gonna pronounce, what the child gonna say. So that's something that the parents can also take note of it. So, some introduction about what would be the assistive listening devices that I mentioned just now. Because if your child is fitted with the hearing aid or the cochlear implant, let's say it's still struggle in the classroom to hear in a distance, where the teacher is talking in the front and your child is sitting slightly behind the classroom. So there will be a lot of noise. The distance also make the signal to be softer. So you may consider to have this type of assistive listening devices. You can always discuss with the audiologist to also think about like what would be the assistive listening devices that is suitable, because this is like a microphone where the teacher can put it on the shirt, clip it on the shirt, and then the sound from this teacher will be captured by this microphone and transmit to the child's hearing aid or cochlear implant. That's gonna also help the child to hear better in the classroom. So there are various of ways to help your child to hear better, but you really have to make sure that the child is diagnosed early and get the correct intervention. If there is fluid, there is any kind of ear pathology that can be resolved, you have to resolve first. Then only we will fit the child with the hearing aids and choose the suitable technology for the child. That will gonna maximum the benefits, for this child. Yeah, that's all I want to share with you about the assistive listening devices and also some hearing aid technology. And last but not least, I would also like to ask Dr. Jennifer, is there any advice from Dr. Jennifer to the parents if the child is diagnosed with hearing loss?
Yes, hi, thank you. So I think it's very important to remind parents or even the relatives of children as young as even 1 year old, if you notice that there is any delayed speech, when you keep on teaching your child to say mama, papa, mom, and it's taking a really long time than the normal for them to verbalize. That's what we call as delayed speech. May mean nothing, but it may mean something behind it. So the first course is to see an ENT, because the ENT would be able to liaise with our audiology colleagues to determine if there is a hearing problem or not. As in even children with ADHD, children with autism, the first thing that we do for the child is to make sure that the hearing is normal or abnormal. That is one of the earliest things to do. And then from there on, we proceed to do the necessary. So, like I had said in my previous slides, the prevention is important. If these are very simple day-to-day things that we can implement in our daily lives, that we can actually spread this news and information of good habits, good ear hygiene, as I would say, of not digging our ears with any instruments, and to make sure that we get early treatment for even a simple flu. We can treat them with over-the-counter medication, flu medications, and if they're not improving in a day, you have to see a doctor, even a general practitioner, or the pediatrician, the ENT, the respiratory doctors, any doctor, to stop the flu from progressing. And because, as like we know, if the flu progresses, it can affect the hearing, whether is it a conductive hearing loss and even a sensory neural hearing loss. Because one thing, the sensory neural hearing loss, once it has affected the nerves, it is almost always a permanent hearing loss. But the conductive hearing loss, like otitis media, there's fluid in the ear, or even wax or foreign bodies in the ear, those are temporary hearing losses. So it's important to note that sensory neural hearing loss almost always is permanent. Once it's permanent, it has taken hold, meaning there is no going back to normal hearing. Yes. So I think that's an important thing for everyone to know.
Yeah, yes, exactly. It's always about, you get the thing right at the first place. Do not
Yes,
wait, do not drag. Yeah,
yes,
that's the most important thing. Yeah, even a ear infection, it can cause so many consequences. Sometimes it can
yes,
be irreversible if it get really worse. Yeah,
yes,
yes,
correct. I
exactly.
agree with you.
Thank you so much, Dr. Jennifer, for her time and kindness to share with us her experiences. And thank you also to the audience for your attention. Your participation in this session make us feel loved and blessed. If you have any question, feel free to leave them in the chat box, or you can ask us, or you can contact us via the contact informations at below of this video. Thank you so much, Dr. Jennifer, for your precious time. See
Yes,
you
thank you
again.
for having me and take
Thank
care,
you.
everyone.
Take care.
Okay, bye.
Okay.